Watson and welcome to Sports Ev, where we hear personal stories from athletes about their injuries. Based on the evidence out there, we analyze what the best options are for injury prevention and treatment. Tonight, we have a unique case with a young gymnast and we'll be viewing treatment options. Does anyone know what the most common upper body injury is in female gymnasts? Yes, that's right. It's an overuse injury in the wrist, technically known as a distal radial physeal injury. After watching tonight's episode, you should be able to do the following. Describe one main mechanism of distal radial physeal injuries in skeletally immature gymnasts. Also, identify and discuss 3 treatment options for gymnasts sustaining distal radial physeal injuries. Now, let's give a warm welcome to Sarah.
Hi. Hi there, I'm Sarah and I'm 13 years old. I've been a competitive gymnast since I was about 4 years old, and now I'm training 25 hours a week, but my coaches want me to increase my hours to about 30 so I can get ready for nationals. The problem is I've been experiencing wrist pain pretty much in any skill I do, mostly tumbling and vaulting. So I've been to the doctor and basically they told me that I'm developing a distal radial physeal injury. So from what I can understand, I guess whenever I bend my wrists, as the doctors put it, dorsiflex, I experience pain. And the doctor said that my growth plates have begun to close earlier than they're supposed to. So when I'm tumbling, I guess the smaller bones in my arms are supporting me, where in like normal girls, the larger bones are doing the supporting. So from what I gather, I need to figure out the best treatment option for my condition so that I can keep improving and further myself in the sport.
Well, that is a touching story, Sarah. Now, let's hear what Sarah's coach has to say about this.
I believe Sarah's wrist pain is likely due to overuse. I believe she's been working too hard on her tumbling. Being a gymnast requires constant bending at the wrist. Dorsiflexion, as she previously mentioned. At the end of your radius and ulna, there are growth plates where your bones are continuing to grow. Because she's only 13, her skeleton has not yet reached full maturity, and therefore the growth plates in her wrist are at a stage of development that places them at a very high risk for injury. Basically, any sort of repetitive compression that is weight-bearing will cause pain for her due to the ground reaction forces being placed on her wrists. An example would be when performing a back handspring, one of the most common skills in gymnastics. These repetitive compressive forces on the wrist are also impinging or interfering with blood flow. This affects the osteoblast and osteoclast activity, basically the formation and reabsorption occurring in your bones. A distal radial physeal injury makes sense considering the fact that she spent the majority of her training hours on her hands, with her wrists in relatively constant dorsiflexion while bearing weight. Now, I've been coaching for 26 years and have had a lot of gymnasts complain about wrist pain. Undeniably, we will need to find a successful treatment option that will allow her to make it to nationals this year. If we're lucky, we have caught it early enough to prevent a stress fracture and possibly premature closing of the growth plate.
Well, now that we've heard a little bit more about the injury, I have a question for all of our viewers at home. Here are some of Sarah's scans. Which image is the normal wrist and which is the injured wrist? That's right! The image on the right shows the partial closure of the growth plates. Let's move on to the evidence and hear about 3 different treatment options.
Gymnastic wrist guards are designed to be useful aids that are worn on the wrist to prevent excessive pressure from weight-bearing activities. It stabilizes the wrist joint and the forearm and promotes proper wrist alignment. It can help the wrist to conform itself to a certain range of motion and inhibit movement in a manner or direction that would be likely to cause an injury. The key to management of wrist pain is wearing a great gymnastic wrist guard. Exercises to stretch the joint are not as important. It is beneficial to rest the joint in a position of best function though. Gymnastic wrist guards are built for this purpose. guards. I have recommended wrist guards to numerous competitive gymnasts, and 90% have had positive feedback. Ultimately, a good wrist guard can help decrease pain during dorsiflexion, allow gymnasts to train longer, and prevent further damage.
In a distal radial physeal injury, the growth plate of the radius has closed prematurely while the ulna continues to grow. The result of this is a change in the distribution of weight when a load is applied to the wrist. The goal of surgery is to reduce the load placed on the ulna, and this can be done in one of three ways. If the triangular fibrocartilaginous complex, or TFCC, is intact, the head of the ulna may be shaved into a conical shape and a section of the extensor carpi ulnaris tendon inserted into the space between the radial ulnar ligament and the bone. If the TFCC is torn, however, a section of the ulna can be removed either from the tip of the head or from the distal end of the shaft. A case study done by Tolat et al. Followed 5 female gymnasts of various levels who had been experiencing wrist pain. 3 out of the 5 opted to have surgery, and all were able to return to the sport at the level they had been prior to surgery 14 to 20 months after. The other 2 gymnasts ceased training and have seen no change in their symptoms.
After reviewing your case, I have come to the conclusion that your best option is to discontinue gymnastics altogether. I have come across a series of cases where young adolescent girls, like yourself, have thoroughly damaged their wrists in trying to become an elite gymnast. The repetitive compression on your wrists during maneuvers such as handstands and back handsprings has caused your distal radial physeal growth plates to slowly close. Since there is no way around these activities during gymnastics, by proceeding with further training, growth plates will surely close. With the closure of your radial physeal growth plates, this will cause your ulna to grow disproportional to your radius, thus resulting in pressure that was normally supposed to be supported by your radius to be put upon your ulna. Another important factor to consider is your age. At 13 years of age, because your bone has not fully developed yet, this is when you're going through a growth spurt. It is easy to alter bone formation at this stage. With constant force applied to the distal radial fasciitis, this causes calcification, which leads to premature growth plate closure. I just recently read a study examining wrist injuries in 59 gymnasts, average age around 9.5 years, and found that an astounding 73% of them had abnormal radiographs of the distal radial fasciitis.
Well, Sarah, you have a big decision ahead of you. Let's ask the audience for some help. Based on the evidence, which treatment option should Sarah go forth with?
Surgery.
Wrist guards.
Surgery.
Quit the sport.
Surgery!
Well, Kim, I've decided to go for the surgery. Based on the evidence, it seems like it's the best option for me. My friend Jane had the same injury and ended up quitting the sport. But, gymnastics is such a huge part of my life that I just couldn't imagine it without it.
Well, thanks a lot for being here today, Sarah, and thank you for watching.